welcome you all to our program this evening, Healthcare Rescue, what businesses need to know about the Affordable Care Act. My name is Margie Jakubowski. I am a partner at Robert Hensley and Associates, and I'm also the program chair for the Simsbury Chamber of Commerce. And we appreciate you taking time out of your evening to be here tonight. I want to take a moment to thank our hostess, Beth Georger, and Hot Meadow Country Club for having us here tonight and for providing us with this lovely space, as well as our presenting sponsor, Aetna and Chamber Insurance Trust. We also have a couple of exhibitors here, Simsbury Bank, PayHub, Robert Hensley and Associates. So we welcome you to stop by the booths after the presentation is over if you have additional questions. Finally, I'd like to thank SCTV for filming us tonight for our viewers at home. Our speaker this evening is Bruce Barth. Mr. Barth is the head of Robinson & Cole's Employee Benefits and Compensation Group, and he's the chair of the firm's tax section, which focuses his practice on representation of employers with respect to retirement and welfare benefits, executive compensation, benefit issues, and corporate transactions. Mr. Barth has spent significant time understanding and speaking on healthcare reform issues. I saw him speak at our annual Connecticut meeting that we had earlier this summer, and hope you'll find the information he presents to you tonight as useful as I did when I saw him. So without further ado, I'd like to present to you our speaker.
Thank you, Margie. Actually, I'm going to put this down since I'm mic'd. And we don't need echoes all over the place here. Good evening, everyone. Just so everyone knows, I had hair before the Affordable Care Act. It's gone now. But that was good then. What I'm gonna focus on some issues today. Oh, before I forget, since I'm on television, my general counsel in my firm would have a heart attack if I didn't read our disclaimer first. So I want to do that now, if you don't mind. And that's actually in the materials that you folks probably have. This seminar is designed to provide accurate information about the subject matter. However, it provides general information only and does not constitute legal advice. No attorney-client relationship has been created. If legal advice or other assistance is required, let me know directly. My contact information is displayed at the end of this presentation. Now my general counsel will be happy and I can speak. Let's talk about, these are the things I'm planning to talk about tonight. The insurance exchanges, how they're working. How the small business tax credit has worked and will work. Talk about the individual mandates, since that's going to apply to everyone in the room, whether you have, if you don't have health insurance. The employer mandate I'm going to talk about a little bit, but I'm going to leave most of that information to your reading pleasure, because I don't believe we have a lot of large employers represented in the room. But let me ask the question, how many employers here have more than 50 employees? Then we have one. You can talk to me later. If you have questions. And then I'm going to talk about some of the taxes, fees, and information reporting rules. So with that, let me get going. The insurance exchanges, as we know, opened to a rousing success on October 1st. I don't know if anyone saw, but this afternoon, they did release the information between the state exchanges and the federal exchanges of how many people have enrolled to date, and I think that was actually as of yesterday. And let's see, that would make 43 days through yesterday, because that was the 12th. So in 43 days, we have just over 100,000 people have enrolled nationwide. Not going very well, and the vast majority of those are in the state exchanges that have been up and running. That's north of 70,000. It was under 30,000 for the federal exchange. So hopefully that will improve with the website. I don't know if anyone has tried to use the websites. I actually have used both the Connecticut website and the federal website and have found, at least to get information, they both work very well. But I haven't tried to enroll anyone yet. And I certainly know the federal exchange is a nightmare to enroll right now. Hopefully that will improve. The state, in Connecticut we have a state exchange. It is not part of the federal exchange. You can get there from the federal exchange if you go in healthcare.gov, But if you don't, you can go there directly, getting into the Access Health, which is the Connecticut exchange. They also are required, the state exchange is required to be established for businesses of 100 or fewer employees. This year for Connecticut, it's 50 or fewer employees for 2014. And so prior to 2016, they can do that. I believe for 2015, Connecticut's planning to go up to 100 or fewer employees. Beginning in 16, they can even open it up to employers larger than 100 employees. And then in 2017, they can open it up to all employers. I don't know necessarily why employers are going to go to the exchange back then, but for now, if you are a small employer, and I'll get to this in a few minutes, the only way you can get the tax credit for an employer is by going to the exchange. If you don't go to the exchange, the tax credit is not available in 2014. And as I said, Access Connecticut is Connecticut's health exchange. The exchange basically has can have 5 different levels of coverage. Those 5 levels of coverage are bronze, silver, gold, and platinum. You'll notice that it sort of like has a Olympic type theme to that. Actually, the person who came up with the name and the levels of coverage was thinking of the Olympics when they did it. And then there's this under 30 young invincible group that only has to buy catastrophic coverage because they feel they don't need a lot of coverage. So those are the levels you're going to find in the exchange. Now in the exchange you have the individual area and you have the so-called shop area. And shop was supposed to be open federally on November 1st. I haven't checked to see if it was. Shop is also supposed to be open in Connecticut, and I haven't checked to see if it's there. I have not tried to use the shop piece. And shop is a small business health options program. As I said before, if you're a small business, if you don't go through this program, you cannot qualify for the small business credit that you would otherwise receive. You have to have at least one employee who is not the business owner's spouse in order to be eligible for this. So if your business is made up of husband and wife, and I guess I shouldn't use that term, if your business is made up of 2 spouses of any sex, in Connecticut especially, then you are not eligible to go to the exchange for the employer. On the employer side, you can go on the individual side. If you have, though, 1 employee, that's all you need, you can go to the exchange and you can then cover the other the spouses and the owner. If you go to the exchange, the shop exchange this is, you must offer coverage to all full-time employees. For this purpose, full-time employee is the same definition as it is for a large employer, 30 or more hours per week. Employers have the option to offer employees qualified health plans, and by the way, QHP here refers to qualified health plan, at a level of coverage selected by the employer. So the employer can select the bronze level as their lowest level. They don't have to, catastrophic they cannot offer as their only level, but they can offer anything from bronze on up to platinum. They also will be able to, beginning in 2015, offer the various options available on the exchange to all their employees. So, for instance, there are 3 in the employer, bear with me a second, I've got to get the right information. In the employer area, there are 3 providers that are offering coverage through the Connecticut exchange. And those 3 are United Healthcare, Anthem Blue Cross, and Healthy Connecticut, which is a new entity, a new nonprofit organization that's formed in the state, having nothing to do with the exchange itself, by the way. Access Connecticut is the exchange, Healthy Connecticut is this new organization. For the individual side, your choices are Anthem Blue Cross, Connecticut, and Healthy Connecticut. So Connecticut is not in one, and United Healthcare is not in one. But so on the employer side, as I said, it's United Healthcare, Anthem Blue Cross Blue Shield, and Healthy Connecticut. So though beginning in 2015, if you as an employer go to the exchange, your employees will be able to choose whatever they want of those plans that are offered by those people. But for 2014, you're limited to 1 insurer. So you have to pick one of those 3 and one of those 3 coverages, and all your employees would only be eligible for that coverage. There's also a 75% minimum participation requirement. And by the way, it will be based come 2015, not on each individual policy that you have, but it's based on the whole plan that you offer. So because 2014 you're limited to one insurer, you need 75% participation in that plan. In 2015 and beyond, you'll have to look at each, you don't have to look at each one separately, you look at the total. There is an exception to the 75% rule between November 15th and December 15th of each year, where coverage is available from SHOP without having to meet this participation requirement. But if you come in at other times during the year, then you have to meet that requirement. If it happens to fall below 75% during the year, that doesn't kick you out because you hadn't met the requirement at the beginning, and then as long as your next open enrollment is between November 15th and December 15th, you don't have to worry about it. If your next open enrollment is any other time, then you may have a problem next time around from a participation standpoint. So that's how the exchanges work. Just by a show of hands, did everyone provide the Exchange Act notice to their employees? Anyone didn't do it? I'm going to raise my hand. We just did it this week, so I can't say. We were told, the Exchange Act notice you have to provide, and there were 2 model notices that the Department of Labor issued that can be used. You were required to provide it by October 1st. However, they told us shortly before October 1st, it was sometime in September, that there's no penalty for not providing it. Well, if there's no penalty for not providing it, there's no urgency that you provide it. So we provide it as part of our open enrollment, because that made logical sense to us. That's when employees would want to know about it. In addition, in the notices that they gave, there were 2 notices. One for employers who don't provide any health insurance. That's pretty straightforward. And 2 is one for employers who provide health insurance. The one for employers who provide health insurance had 3 pages to it. Page 1 was basically information about the exchange itself, and then who to contact at the employer to find out about if they had questions about the employer's plan. Pages 2 and 3 went into a lot of detail concerning the employer's plan. Who completed pages 2 and 3? Anyone? They were optional pages. You did not have to provide that information. And I strongly recommended to our clients that you not provide that information, because what if you were wrong in what you provided there? Yeah. And which is a very likely scenario, by the way. So all you needed really to do was provide that first page, and that's what most employers, I think, have done. The notice has to be provided to all employees. You don't have to give it to dependents, just have to give it to the employees. If you hire a new employee, you have 14 days to provide that notice. It can be sent electronically, it can be given by first-class mail, you can hand it to them. Any reasonable delivery method works for this notice. We don't have to go through the incredibly complicated Department of Labor notice requirement rules in terms of electronic delivery, when you can do it and when you can't. In this case, anything works. Let's go on to the small business tax credit, because all of you who are small employers are eligible for that. The amount of the small business tax credit increases to 50% in 2014. That's a pretty big number. However, to be eligible, you have to have fewer than 25 full-time employees. You exclude your owners and family members for this purpose. And it's not full-time equivalent, it's actual full-time employees, and full-time means 30 or more hours a week. They have to have average wages of less than $50,000. It's a lot easier to achieve in Mississippi than in Connecticut. Yeah. So in Connecticut, qualifying for the credit is not going to be as easy as in some of the other states. The employer must pay a uniform percentage of the premium for all employees for single coverage only, by the way, for employee coverage. We're not looking at family coverage for this purpose, but for single coverage of at least 50% of the premium. Well, most insurers are going to want you to do that anyway for underwriting purposes. If you have more than 10 full-time employees, or their average wages are more than $25,000. And if you're in Connecticut and your average wages aren't more than $25,000, I'm really wondering what your business is, then that 50% credit is reduced. So it's highly unlikely in Connecticut that you would ever get the full 50% credit. You might, but I think it's highly unlikely.
What is it reduced to?
It's gradually reduced. It could go down all the way down to zero. The credit is only available for 2 consecutive taxable years. Okay? You can't get it more than 2 years. And it's limited to the percentage of premium you pay. As I said earlier, beginning in 2014, you can't qualify for the credit unless you get your insurance through the shop exchange. If you get it from through an insurance agent or broker, and you just are keeping the same insurance you had before and you're not buying it through the exchange, the employer is not eligible for this credit. And that does not make any sense to me, by the way. Let's talk a little bit about the individual mandate. And no, I do not think there will be delay in the individual mandate, despite everything you may hear about the exchanges. So beginning in 2014, to avoid a penalty, and the penalty is the greater of 90, for 2014, it's the greater of $95 or 1% of effectively your adjusted gross income. There's been a lot of miscommunication out there saying the penalty is $95. No, it's 1% of your adjusted gross income if higher, which in most cases is going to be true. For those people who make less than 400% of the federal poverty level, and 400% for a family of 4 is roughly $94,000, so it's not a low number. They can get a credit or a subsidy, I should say, through the if they use the exchange to get their health insurance. Medicaid is expanded. Connecticut took the expansion, so it goes $16,000 you had to be making, or $21,000 for a family, or a married couple, I should say, to be eligible for Medicaid. That's pretty easy. That's, there aren't a lot of people in Connecticut who are there. There are a number, I should say, but they're not necessarily the people we're talking to here. You are responsible only for insuring yourself, and you're also responsible for insuring your dependents. The way the healthcare rules work, and this is true for if you're a large employer as well, you have to cover yourself and your dependents. You don't have to cover your spouse. Spouses are responsible for themselves. The January deadline has been delayed to some degree, but effectively the rules kick in on January 1st that you're going to have to pay the penalty. As I said, the penalty is $95 per uninsured adult, $47.50 for children, up to a maximum of $285 or 1% of your adjusted gross income. And as you can see, the penalty goes up significantly in 2015 and 2016. 2016, it's $695, and with the same adjustments, half for children with a cap, which is basically 3 times the individual penalty, or 2.5% of your adjusted gross income. That could be a significant number if you don't have insurance. Let's talk a little about the employer mandate and some of the penalties, and then I'm going to open it up for questions, because there are probably a lot of them that you have. So large employers, 50 or more full-time equivalent employees is what a large employer is. So if you've got 30 full-time employees and 60 part-time employees, you may probably have 50 or more full-time equivalent employees. They are going to have to pay a penalty if any of their employees go to the exchange and get a premium tax credit, and get a subsidy, I'm sorry. Premium tax credit is for the small business, subsidy is for the individual. If they get the subsidy, anyone gets a subsidy, they could have a penalty. They won't necessarily have a penalty, but they could. If no one who works there goes to the exchange, or no one who works there goes to the exchange and gets the subsidy, they never have a penalty. So you could have a lot of uninsured people working for you, but if they never go to the exchange and never get a subsidy, you don't have to worry about it. You won't have that issue. As I said, a large employer is anyone who has 50 or more equivalent employees. For purposes of determining full-time equivalent status, you take the number of hours they work and divide it by 120 for a month. So if they're working 120 hours or more a month, roughly 30 hours a week, they're a full-time employee. If they're working any portion of that, you add them together and you see if you get to 50. An employer will, and by the way, we know the employer mandate's been delayed till 2015. Is there anyone in the room who didn't know that? Just out of curiosity, it's been in the press just a little bit. The law does not require you to offer coverage as an employer. You still do not have to offer coverage, but in 2015 you may have to pay the penalties. So, basically the conditions to avoid the penalties are that you offer coverage, the coverage has to meet minimum essential standards, and the coverage has to be affordable. Basically those three criteria. You offer coverage if you just give them an effective opportunity to join a plan sometime during the year. Minimum essential coverage basically means any healthcare plan that meets the minimum requirements of the healthcare law, which I don't know of any insurers who aren't offering those right now. They're all required to. That's why people have lost policies and getting these non-renewal notices. Do not confuse minimum essential coverage, which is these health plans, with essential health benefits, which is what is required to be in any insurance policy now. They're two different things. You need minimum essential coverage to meet the individual mandate and the employer mandate. So what is minimum value? It means that the plan pays for no less than 60% of covered health care expenses. HHS, Health and Human Services, online has a calculator that you can use to determine if your health care plan meets these requirements. 98.5% of the employer-sponsored plans in this country meet this requirement. It is highly unlikely that an employer-sponsored plan would not meet this requirement. What is affordable coverage? Affordable coverage, as I said, is basically 9.5% of, I've said adjusted gross income, it's really household income, which is a very close number. They're not quite the same. Now, how many of you know how much your employee's household income is? You really, you're going to start asking them for their 1040s? You're not going to have to do that. Basically, the IRS has given us some relief in this area that basically says you can look at their rate of pay, their W-2, if they make more than the federal poverty level, to determine whether the premiums you have to pay are more than 9.5% of that number. The odds are their income is higher than the number you pay them. They probably have some other income. Hopefully they don't have losses, because they could theoretically be making less if someone's got a small business that's losing money all the time. But basically you look at the individual's income and you look at for a single policy, a policy for the individual, not for a family. So affordability is based on the individual, 9.5%. There's been a lot of talk about this so-called defined contribution approach, which is we're going to give you, employee, $5,000, go find your own health insurance. And we're going to try to do that on a tax advantage basis, so that $5,000 won't be taxable to you. The IRS shot that down this summer. Very quickly. Actually, they thought they shot it down back in February, but they clarified this summer to make sure they really shot it down. So a defined contribution approach only works if you sponsor a health care plan and you have a plan that works for all employees. But you can't just say, here, take some money, go to the exchange, buy a policy. That will not work. So what are these employer penalties? First of all, remember the employer penalty only applies if you have 50 or more full-time employees, full-time equivalent employees. And then the penalty only applies on an employer-by-employer basis. And the penalty applies if you have 50 or more employees, not full-time equivalent employees, for these purposes. So each employer needs to look at that. So you could be a large employer and still not have a penalty. There are two types of penalties, the A penalty and the B penalty, and you don't have to pay both, you're going to have to pay one or the other. A applies if you provide no coverage, and that penalty is $2,000 times the total number of your employees with the first 30 free. And that's full-time employees, by the way. So your first 30 employees are free. So if you have 30 or fewer full-time employees, you will never, ever have to worry about a penalty, unless they change the law. Penalty B is if you provide coverage, but it's either not affordable, doesn't meet minimum value. In that case, the penalty is the lesser of $3,000 times the number of full-time employees who receive assistance as the premium subsidy from the federal government, or penalty A if lower than that. Now remember that you need to go to the exchange to get a subsidy for the penalty ever to apply. But once again here, if you have fewer than 30 employees, you're not going to have to pay a penalty, because it's the lesser of those two. So if penalty A is 0, you never have to pay a penalty. You have to offer coverage to 85% of your full-time employees, because there's going to be some room for error. There may be employees who don't quite meet. You're not sure whether they're full-time. They're variable hour employees. And no, I'm not going to talk about those complicated rules tonight. They're in my materials. You can read them. But my prediction is they're going to change. So let me show you an example of the penalties. You have 100 full-time employees and 5 employees go to the exchange and get a subsidy. If the employer doesn't offer coverage, your penalty is 100 minus 30, which is 70, times $2,000 or $140,000. Not an insignificant penalty, but it might be cheaper than providing insurance. So you have to look at your options. And now for competitive reasons, you may need to offer insurance, but you have to look at your options there. If you offer coverage that's not affordable or doesn't provide minimum value, then the penalty is the lesser of the $140,000 we just talked about, penalty A, or the number of employees who receive subsidies. Well, that's 5 times $3,000 or $15,000. That would be your penalty in that case. So just offering coverage, even if it's not great coverage, saves you a lot. As I said, I'm not going to cover anything more in that area. I'm not going to go through the employer mandate. I think all of you received the materials, and if you didn't, I certainly can get you a copy. So with that, let me rapidly flip through to the end. I'm not going to talk the taxes, the transitional reinsurance tax and the premium tax. I'll briefly mention. Transitional reinsurance tax is being paid by the insurance company, so I wouldn't worry about that. There are additional taxes that are built in to healthcare reform that apply to any coverage, to employer-provided coverage, and it only applies to insured plans. And it's estimated to be between 2 and 3% of the premium increase. So that's probably, most of you are seeing that in your premium increases. So you should prepare, basically for planning for next year. There's not much, you can prepare for 2014, you probably already have. It's more like preparing for 2015. You need to determine whether you're a large employer. Once you determine that, you need to determine if you're a large employer, then you need to prepare for penalties. If you're not a large employer and you're possibly eligible for the tax credit, go to the exchange, because it's the only way you're going to get it. But I will say the law keeps changing. Or I shouldn't say the law keeps changing, because Congress can't pass anything, as you know. But the regulations and the rules change almost daily. At least every week there is something new that we have to keep on top of. So you can assume that anything I gave you tonight may not be true next week. That's why I didn't talk about the employer calculation rules. I can guarantee you they're changing. That was one reason for the 1-year delay. But talk to your vendors, they should stay on top of it. There's my disclaimer again. And with that, let me open it up to any questions.
I'm going to take the mic from you, and
It's right here.
I'm going to use the mic because we are taking this for TV and for SCTV I'm Charity Folk, Executive Director at the Simsbury Chamber. If anybody has a question, if you raise your hand, we'll bring you the mic. While we're waiting for any kind of question, we've heard before one spouse is not eligible for Medicare, another one is. Do you want to speak to that?
Yeah. If someone's eligible for Medicare, they are exempt from the penalties. Penalties doesn't apply if you're eligible for Medicare and enrolled in Medicare. And remember, eligibility for Medicare and enrollment in Medicare are two different things. Make note, if you're working and you're eligible for Medicare, you're not going to be enrolled in Medicare. You may have been enrolled, but you're not going to be getting it. It'll be secondary at all times. For the spouse, though, the spouse still has the individual mandate apply to them. So they need to have coverage from some source, even though they're not eligible for Medicare. Yes?
Question, I'm going to come on over to Anthony.
What are good resources to find? So we're saying it changes a lot. I've done a lot of research. I have a medical practice, so I'm concerned on the provider side. It's hard to find, in my opinion, non-biased information out there. So what are your sources? What are sources we have access to?
Well, there's a lot of information you can always get on the internet. If I would certainly say, and I'm not going to pick on any news organization of any type, do not listen to the news. Most of the information you're getting is inaccurate. I heard during the government shutdown, I heard a congressman who was on that's saying a family needs to get divorced because they have three franchises and they can't afford the penalties associated with health care reform. Divorce wasn't going to solve their problem. And moreover, their penalties aren't going to be that bad. They may not have any penalties depending on their size and all that. So there's a lot of misinformation out there. Certainly don't listen to anyone from Congress. And unfortunately, I have to say that don't listen to the president right now either. There was a lot of misinformation out there. But I would say go to the internet, use those lovely places that we like to search with, and you can get good information. You don't have to check daily. The rules change constantly, but you'll probably see in the press that there's been some major change if it happened. And that's when you can go on the internet and get real information. And it'll come up in a good search. I have no trouble finding that when I do it, especially if something is just released. We get legal periodicals in my office where I get updated daily on everything. So I've got it by at least the next day. But sometimes I want to know immediately when something is issued, and I'll get some alert on that, and then I'll go on the internet and see what's been. I can go out there and find what the IRS or the Department of Labor or what Health and Human Services has just issued. Because they upload it immediately.
I have a question. I wondered if anybody here has actually gone on the exchange and or registered through the exchange. Has anybody done that? Just a small handful.
How was the experience?
Yeah.
It was actually pretty easy. I just wanted to figure out what the pricing was and how I heard all the nightmares about getting on. With the Connecticut Exchange, you just went through a little bit of information, and it came back with...
That you came back with a quote, but you didn't enroll.
I didn't enroll, no.
Okay. One of the reasons why I asked it, because I think a number of us may have gone on the exchange to get some information, but Norris Christensen happens to be here today and has some experience with Christensen Insurance. If you're going to go on the exchange, what you need to have in front of you as you go on the exchange, what is needed, and maybe how long it takes.
I'll give brownie points. The exchange does work, but the concept that it's quick and easy, no. Anybody applying through the exchange who would be eligible for a subsidy better at a very minimum have their tax return, every family member's date of birth and social security number handy. If you don't have that, you won't be able to finalize the process. And in our experience so far, we've only done a handful of them, but generally the process takes at least an hour to get all that information input. So just be prepared. Unlike a famous politician who said it was as easy as buying a book on Amazon, it's doable, but it's not that easy.
And let me mention a little bit my experience on I've gone on the federal, as I said, and also on Connecticut's. On Connecticut's, I went on solely to see what pricing is. You can get pricing information very easily. I had a heart attack at that point in time, so my health insurance premiums went up immediately. But I also can tell you that the exchange premiums are going to be higher because they have no experience. They have no idea who's going to sign up for that. And usually the people who are most likely to sign up are those who are not in good health. So we're going to need the exchange. That's why premiums are so high on the exchange. I will say you might be able and probably can get better pricing outside of the exchange right now. That may change over time, but at least for 2014, I think it's highly likely, at least in Connecticut, you're going to get better pricing outside of the exchange. I also went on the federal exchange because I have a son who's in grad school, not in the state of Connecticut. So I didn't want to go on the Connecticut exchange. And I wanted to get pricing for him because unfortunately as a partner, I pay 100% of my health insurance premiums. So if you think your insurances are high, try paying 100% of the premium. I looked, and he's in South Carolina. I can get him bronze level coverage through Blue Cross. That's a decent plan for $190 a month. That would be an unheard of number in the state of Connecticut. Yeah. But that is a lot cheaper for me. I can get him platinum level coverage for less than the difference between my wife and my coverage and my family premium. So I'm more than likely to get him coverage through the exchange that way. He'll be out in the workforce in May. It'll be his problem after that.
We have a question from Bob Hensley.
Yes.
And Robert Hensley and Associates, who's one of our sponsors this evening. Maybe you can also talk, because you have the experience of not necessarily exchange, but offering direct plans, private insurance. So maybe you can talk to that as well as your question. Did I put you on the spot?
Well, no, because I'll just defer to Margaret. The question, well, kind of question and comment I'd make, because I've been on the Connecticut exchange, and I've also tried to go on the federal one, which was down every time I tried. But the form of the subsidy is kind of, to me, I mean, can you talk about that? When people get a subsidy, what does that really mean to people? I mean, it's not like cash, but can you talk about that just a bit?
Yeah, what my understanding of how the subsidy is going to work is you're going to go to the exchange, they're going to say you qualify for a subsidy, and it's not going to, remember, the subsidy is a graduated number. It's not an all or nothing number. It's based on what your income level is. And you are going to get that subsidy by reducing what your premium is that you have to pay to the exchange for your coverage. If you get a full subsidy, you're going to have to pay nothing for your coverage. So it'll be pretty straightforward in how it works. Now, one interesting thing I learned recently is that if someone goes to the exchange and gets a subsidy, Connecticut's exchange, at least, I can't say if this is true nationally, but Connecticut is then sending a notice to the employer telling them that they have an employee who's qualified for the subsidy. And I was very fearful before that wasn't going to happen. So employers wouldn't know until after the end of the year that they had employees getting subsidies on the exchange and that they could have penalties to pay. And if that was true, they wouldn't have been able to do anything about it. Moreover, I think it's highly likely, and I'm not saying people are giving misinformation, but I think it's highly likely that people are going to get subsidies on the exchange when the employer has offered them health insurance that's affordable and meets all the requirements. Because they're not going to tell the exchange that happened. Maybe because they don't know how to, but that's going to happen, and then the employer is going to get hit with a penalty. And by the way, the first time I'm worried about penalties hitting will be sometime after the end of 2015, because the IRS is going to get all the information in after the end of 2015 for 2015, and that's when the penalty notices will start going out to employers. And that's when they're going to have to deal with it.
I just want like a follow-up. So what? Sorry. There's so many moving parts here.
Yeah.
But define income. So people that, I know no one would ever do this, but someone might decide that, rather than paying premiums, I might qualify if I arranged my income in a certain way. So could you just address what goes in that column that would accumulate to adjusted gross income?
Yep.
And what maybe the potential issues would be for someone who was going to be a little creative with that, if I can say it. Yeah.
Well, let's start with, you can't get creative with your W-2 because your employer is reporting that to the IRS. So if that number doesn't match, I can guarantee you, you will be getting a letter from the IRS saying, our W-2 says X, your W-2 says, your 1040 says Y, you've got a problem here. That's first. Secondly, you could have interest and dividends. Those are reportable on a 1099. The IRS matches those up too. So hopefully they're reporting all those things. Where things get interesting, also included in adjusted gross income is what's called Schedule C income, which is the income for a small business, self-employed, where you have no other ownership, or on income from a K-1, which is on Schedule E. I'm a partner, I get a K-1 every year. And that, there isn't not near, in the Schedule C and the Schedule K-1, and then on the K-1, there's not nearly as much matching that goes on. So, and also, you can play around with your expenses and come up with different numbers, so your income may not really be what you report to the government may not be what it really is. Not to mention small businesses, we know there's a lot of cash businesses that are not out reporting all their income. The only way the IRS finds out about that is to audit the business. They're not going to do that for the healthcare reform premiums. They'll do it just because they do it, but I don't think just because of healthcare reform premiums they're going to do it. Those are the main items of income. But also to get to adjusted gross income, there are some deductions that apply. For instance, if you contribute to an IRA, that reduces your adjusted gross income. If you contribute to a qualified plan as a partner like I do, that reduces your adjusted gross income. You contribute to a health savings account, that reduces your adjusted gross income. You're a self-employed person and you have health insurance. That premium reduces your adjusted gross income. You contribute to any retirement plans. That reduces your adjusted gross income. And there are some other adjustments that occur in there too. All the items on your so-called Schedule A, which you attach to your 1040 if you're taking itemized deductions, none of those reduce your adjusted gross income. That's all after you get to adjusted gross income.
I was going to ask Margie if she could give us a little experience, because October is renewal. So some of the experience that you're going through right now, and some employers are opting to take maybe the same coverage they have now to delay all these big decisions. Maybe you can just talk to that.
Sure.
Because I think sometimes people think they have to go to the exchange. But they absolutely do not, right? Yeah.
Correct.
Go ahead.
Yeah. I would echo what Bruce and Norris have both said, which is that it seems at this point that if you don't qualify for the subsidies, then the exchange may not be the place that you want to be, and that it is a time-consuming process to go through the enrollment for the exchange and pay stubs. Current pay records is another thing that we found people need to have in order to enroll. But depending on who you are and how big you are and how many people you employ, you may want to delay some of this by doing an early renewal. And if you're an individual person, that's been a strategy that some have taken on too if they're willing to go through the underwriting requirements. So, but talk to your broker, work with the people who know about this and that they should lead you in the right direction.
You
don't have a broker.
Oh,
I mean, I have an individual.
right next to her.
There.
Or Bob.
If you're an individual.
Right. If you're an individual, you can go.
There's no point
Right.
of going to the exchange, really. Does it benefit you if you only have an individual, if you have no employees, if you're just
If you're just self-employed, one, the premium tax credit won't matter. And if you can get insurance somewhere else, which I'm sure you probably have in the past, if you had insurance.
Yeah, well, it's
yeah.
canceled now.
Right,
They're not-
because the policy is not what it was. But you can still go to the insurance company and see if you can get it. I'm sure they have different policies. They'll probably cost you a little more. But the exchange is likely to cost you a lot more as an individual, just because of the underwriting that they've gone to the exchange with. So I would always explore the exchange's pricing, because that gives you a baseline to work off of for the coverage you want, and then see if you can find it better in the marketplace, outside of the exchange. Beware, exchanges, remember, are also called marketplaces. It's just going to confuse you. They've tried to change the name because that's what they wanted to use.
Karen, meet Margie, Margie, meet Karen.
Well, and brokers can help people through the exchange too. So
Yep.
there is somebody who can help you navigate the system.
Right.
We have
That's
any-
important to understand, is that brokers can help you. There's a certification process, so brokers, you can go to a broker and a broker can help you go through the exchange. You don't have to, fend for yourself necessarily. I mean, it's not like if you go to the exchange, you're excluded from dealing with a broker.
Correct.
They have to be certified, but,
Yeah, they're called navigators.
well, no.
Oh, no,
I'm
no.
not talking about
Oh,
navigators.
we're not, oh, you're talking about otherwise? I'm sorry.
I'm
My
talking
apologies.
about like
My apologies.
insurance agents
Yep.
like yours or
Yeah,
or
they
our
can-
firm. Or
yeah.
A number of quality firms have people who are certified to assist you and help you through the
Yep.
exchange.
Yep.
You don't have to go out there all by yourself. But
How does the firms benefit from you signing up on the exchange rather than going through one of the lines that they usually use?
how do the insurance agencies
What do they get?
benefit?
What
They
do
get
they
a
get?
commission.
They do get something.
Yes, they do. They're
That's
compensated.
That's not written anywhere.
No, but there's a big, long list of those kinds of things.
Yeah.
Okay.
But your rates are no higher by using an
So every day is a new day in this.
Bob, it is true that your rates are no higher by using an insurance
Right,
agent.
it's the same, absolutely.
It's the same rate you're going to get, because the rates that are approved by the state insurance department doesn't matter whether there's a commission payable or not under it.
Right. It's all the same.
I learned that myself in the sense that feel free, do not have to go onto the exchange. Feel free to go to your regular broker or to an insurance broker and get some questions answered. You're not forced to go onto the exchange.
Right. And you're not forced to have health insurance, despite what people say.
Bill has one.
Yes.
Bruce, I'm sorry, a question on the penalties.
Mm-hmm.
Have they decided whether this is an additional tax so that they can add it to the total tax due? One of the rumors going around, and I got this from a fellow CPA, is unless you have a refund, they aren't going to be able to collect that additional penalty, that they can't add it to the total tax due, which seems a little far-fetched because I thought it was settled that it was additional tax.
I think that goes along with some of the other rumors that are out there. The Supreme Court held it was a tax. So as far as I'm concerned, they can certainly add it as an additional tax. If the Supreme Court held it's a tax, it's a tax. But there are a lot of rumors out there about things you can do. Give the employee money and let them go to the exchange. That doesn't work anymore. Don't try to take away benefits from your employees solely for the purpose of taking away benefits. There are two types of claims that are out there. One is under healthcare reform, and you'll never hear me use the O word, just so you know. It's either ACA or PPACA. You can call it either one. But under ACA or PPACA, there is a penalty if you are taking actions to deny someone healthcare coverage. So be careful when you change your policies to try to exclude people from coverage. You can change your policies, but don't try to exclude people. That could be a problem. ERISA, which has been in existence for almost 40 years, has a section 510. That provision's been in existence for the same 39 years that ERISA has existed, and that says you cannot interfere with someone's right to benefits. If you're taking actions to try to deny employees benefits by lowering all your workforce to 29 hours, we've heard about that game. I think those employees have a 510 claim under ERISA. And I think you better be very careful if you try to do it.
I'm going to be somewhat mindful of the time. John has a question. If anybody else, we're going to just wrap that up a little bit. We got a couple of questions. But I also ask you to stay for a moment to hear from our three sponsors that are here tonight to find out what they have to offer, because each one has something a little different that you might want to find out about them.
Thank you, Bruce. If you have small organizations, one or two or three person LLC, maybe with a couple of clerks or a partnership or something like that. Do these notices apply to everyone? One person LLC, do you have to send yourself a notice?
You won't? The note, actually, that's a great question. I should have addressed it earlier. I apologize. You only have to do an exchange notice if you're subject to the Fair Labor Standards Act. That means you pay one employee on a W-2. Then you're subject to the Exchange Act notice requirements. Otherwise, if all your people are self-employed, like you're in a partnership and all you have is partners, FLSA rules don't apply.
Or 1099.
Well, are they employees or are they not? That goes to the question. That issue's still out there. Are the people who get a 1099 really employees? If they're really employees, you should be giving them a notice. If not, if they're legitimately not employees, then you don't have that issue.
We can help you with that. So Danielle was going to ask a question, but Danielle is also with FAHA, and so. Right, great. Danielle has a comment, and she's going to tell us a little bit about why FAHA is here tonight, what you can offer.
Thank you so much. So my name is Danielle Serio. I'm the Director of Community and Customer Relations with PayHub. PayHub offers payroll and payment processing, and because so many of our clients are small and mid-sized businesses, we've sort of taken it upon ourselves to become experts in this area as well. And I actually just wanted to mention that if you are not a one-member LLC and October 1st payment went without you notifying your employees, we have plenty of copies of the notices for people who are both offering insurance and not offering insurance. So take a copy or two, make as many copies as you need, and we'll be at the table here if you have any questions after. Thank you.
Do you have any specific aid or guidance or help on the Affordable Care Act that PayHub offers?
Absolutely. So like I said, we're sort of taking it upon ourselves to become experts and stay abreast, as you mentioned. Mr. Barth said that it changes almost daily, and so we're sending out plenty of notices to everybody on our email list. We have special reports that we can do for all of our payroll clients that actually calculate their full-time equivalencies. And that's essentially it right now. With everything changing, like I said, we're sort of just staying as in front of it as we can and prepping our clients as well as we can.
We have Terry Bolton from Simsbury Bank, who's going to talk a little bit about why you're here tonight. Thanks, Terry.
Thanks for having me, Terry. Simsbury Bank offers high HSAs, health savings accounts, and that's a very viable vehicle for a lot of individuals and companies to offer high deductible plan insurances. So HSAs are partnered up with that, and we think that's going to be a way that some people will be going with the new healthcare reform.
Okay. And then I'm going to end with Margie, who started our program tonight. Margie, maybe you can tell us a little bit about Robert Hensley Associates, and then I'll let you wind up the program.
Thank you. Thank you, Charity and Bruce, and again to PayHub and Simsbury Bank. I'm Margie Jacobassi, as you know from earlier. Robert Hensley and Associates is an agency in Avon, and we help employers and individuals with their insurance planning and specializing in benefits and health insurance. And right, day to day, that means just keeping on top of what's going on and helping folks navigate through the system and pick the plan that's the most appropriate for them and their employees in the changing times. So we're very busy, always learning. It's an exciting time right now for us, and we welcome the chance to talk to anybody here if they have extra questions afterwards. Thank you. So thank you again, and hope everyone will stick around for a little more networking after this.
And I'll be here if anyone has questions.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.